A Naples doctor saying the case of tuberculosis at a Collier County school could have been prevented. In fact, he went before the school board to discuss TB screenings back in September. 4 New Corner's Lisa Greenberg spoke to the doctor himself, who says there needs to be a change here. Lisa?
Well, Amy, Dr. Joseph Doyle says this comes down to TB screening. Right now, kids are subject to a skin test, but Dr. Doyle says the blood tests are more accurate because they're lab tested instead of read by a physician. And he suggests blood testing foreign-born kids to make sure they're not bringing TB to our schools.
We don't have a modern-day Ellis Island, but we need to create a virtual Ellis Island in this country.
And public health and preventative medicine Dr. Joseph Doyle says that's what he's been working to do for months. With so many foreign students within our country's borders, he's thought about the possibility of tuberculosis and other infectious diseases making their way into our public schools. He took those concerns to the Collier County School Board in September and October, specifically discussing TB screenings.
I want the foreign-born students to be tested with the blood test.
He says they're worth the higher cost, but says the school board didn't give any feedback.
If the surveillance program that we're looking at had been implemented in the fall, this student would have been detected earlier.
Over the phone, Health Department spokeswoman Deb Millsap tells me the student with TB from Lely High School is foreign-born, but has been in the U.S. for years. She says the last time they've had to deal with an active case of TB in public schools was in the 90s. So switching TB tests doesn't seem worth the cost.
If we saw more active TB, then maybe it would provide cause for doing that. But at this point, the system seems to be working.
I reached out to the Collier County School Board members and superintendent by phone and email. Board members Erica Donalds and Kelly Lichter were the only ones to get back to me. They weren't serving on the board when Dr. Doyle brought up the issue. While both say they'll bring it up at future meetings and look into the procedures in place, they stopped short of endorsing Doyle's plan. Now, Dr. Doyle says he hopes the board will do a presentation to explain the district's testing requirements at their next meeting. He also says he hopes the school board and health department will become more proactive rather than reactive. Live in the studio, Lisa Greenberg, Fox 4, in your corner.